Hello, everyone. Welcome to the fourth annual Bloomberg American Health Summit. Our mission at Bloomberg Philanthropies is to ensure better, longer lives for the greatest number of people. And through our public health work, we're doing just that. But we all need to do more. We announced the launch of the Bloomberg American Health Initiative back in 2016 because in the United States, life expectancy had decreased by more than 2 months from the previous year, the first decline in almost a century, which is unacceptable for a nation as great as ours. And due to COVID-19, life expectancy has gone down again by approximately 1.5 years. But much of what caused the initial decline existed before the pandemic. And unless we confront those things head on, they will continue to exist long after the pandemic ends. This summit is a chance for us to come together, to learn from each other, and identify solutions that will save lives. And I just wanted to briefly mention one way we're doing that at our foundation. A few years ago, we looked at the data behind that first downward trend in life expectancy. It was clear that a major cause was one of the worst public health crises we've ever faced, the opioid epidemic. About 130 Americans die from an opioid overdose every single day. Since the epidemic began over 20 years ago, more than 750,000 Americans have died. In 2020 alone, an estimated 93,000 people died from overdoses, the largest number ever recorded in U.S. history. These numbers are staggering, and the human toll is truly tragic. The victims left behind millions of people who love them, children and grandchildren, partners and parents. This crisis is tearing families apart across the country. In 2018, we began responding directly to this crisis in Pennsylvania, working with Governor Tom Wolf. And in 2019, we expanded our efforts to Michigan, working with their governor, Gretchen Whitmer. Our goal is to save lives and provide people the help they need to tackle and manage their addiction. Our approach has included expanding access to medications, treatment, and harm reduction services. We also have been working to promote a public health approach over a criminal justice approach to drug overdoses. And we've led communications campaigns to reduce the stigma of coming forward for help. Thanks to a lot of great work by our partners on the ground, we've been able to make a big impact and save a lot of lives. Between 2017 and 2019, opioid overdose deaths decreased in both states, even as they increased nationwide. In fact, Pennsylvania had the largest decrease in overdose deaths of any state in the country during that time frame. Tragically, during the pandemic, some of that progress has been reversed. The epidemic has gotten worse everywhere. But compared to the national averages, the increase in deaths has been much lower in Pennsylvania and Michigan. So it's clear that we are making a big difference through a data-driven, state-based approach. But we also know that we have a very long ways to go. So today, I'm glad to announce that we're expanding our work to 5 more states: Kentucky, New Jersey, New Mexico, North Carolina, and Wisconsin, and also pushing for comprehensive action at the federal level. Bloomberg Philanthropies is committing $120 million over the next 5 years, and we've set a clear and achievable goal: reversing this upward trend to overdose deaths with an aim to reduce those deaths by 10% or more in our 7 focus states. Now, it won't be easy to end the opioid epidemic, to say the least, but achieving the impossible is what public health work is all about. That's never been clearer than it has been recently. Public health workers have been on the front lines of one of the greatest challenges the world has ever seen, and they have done heroic work. So I'm optimistic about what we can achieve by working together. And I want to thank you for being so dedicated to this critically important mission and for being with us today. Now, I'm glad to introduce Dr. Kelly Henning, who leads our public health work at Bloomberg Philanthropies. And you're also going to hear from the governors who are our partners in the fight to end the opioid epidemic.